Thyroid Cancer Introduction. Which one of the following is true about the thyroid gland? Choose one of the following options. 1. It has 2 lobes. 2. It has at least 4 parathyroid glands. 3. It produces important hormones. 4. All of the above. Correct. Are all nodules on the thyroid cancerous? Select yes or no. Correct. Only malignant nodules which invade other tissues are cancerous. Benign nodules are not cancerous. Is it always possible to determine the cause of cancer in a patient? Select yes or no. Correct. It is usually impossible to specify the causes of cancer in an individual patient, but general causes of cancer are known. Which of the following are symptoms of thyroid cancer? Choose one of the following options. 1. Hoarseness. 2. Trouble swallowing. 3. Pain in the throat or neck that does not go away. 4. All of the above. Correct. Hoarseness, trouble swallowing, and pain in the throat or neck that does not go away are all symptoms of thyroid cancer. The only sure way to diagnose thyroid cancer is through a biopsy. Select true or false. Correct. A biopsy is the only sure way to diagnose thyroid cancer. Determining the stage of thyroid cancer helps healthcare providers know which treatments are best. Select true or false. Correct. Staging is important in deciding the best treatments. Which of the following are possible treatment options for thyroid cancer? Choose one of the following options. 1. Thyroidectomy. 2. I-131 therapy. 3. Radiotherapy. 4. All of the above. Correct. There are many treatment options for thyroid cancer. Treatment decisions are based on your age, the stage of thyroid cancer, and the type of thyroid cancer. Thank you for using Explain.